I'll do it. Okay, sharing now. Great. Thanks everyone for joining. I'll be talking, as Roger mentioned, about a big global structured expert judgment study done for WHO on source attribution. And this is not work by myself. I'm together with Tine Hald, Roger Cook, and Willie Aspinall, having a look at or discussing the expert judgment part of the study, because the study also implied other parts as well. But let me start by saying, okay, what is source attribution? Because we think about, viruses, protozoa, bacteria, parasites, and so on. And at the population level, we talk about what happens and what kind of infection it is. Hepatitis E, for example, here as an example, thinking about, okay, what symptoms we can have, how it can be prevented, and so on. But it's also of very much interest how it spreads. And it concerns us humans that we can take hepatitis E by either direct contact, food and beverages, by the cups and spoons not being clean. But from authorities' point of view, it's also very much interested how much does this infection arise through this different spread pathway. So what it can be, and it's here as a source attribution to all these infections. And there are many ways to consider it, and there are a number of categorizations. But here, what we did for the WHO study, we considered 6 major pathways, which is either food or animal contact, human contact, water, soil, and a category which is called other. And also at the food level, we were specifically looking into certain food groups. So either at the meat types, vegetables, fruits, and so on. You have a list there of 14 food groups that we considered. So in general, this is the source attribution, and it focuses on getting either at the major pathways or a food group level for various hazards, we call them in general, and we will see a whole list. But to broadly put it, the purpose was to have this global expert judgment studies of source attribution, where it was aimed to estimate the proportion of burden of disease by food-associated hazards that is attributable, like I said, to this particular transmission routes and specific foods. It was also said to use expert judgment, and the idea was that having global study and having a look at specific regional insights and tailoring knowledge to those specific regions, expert judgment was said to be the only approach able to deliver estimates for the attribution. And therefore, this was the employed methodology. WHO was advised on this project by the Foodborne Disease Burden Epidemiology Reference Group, known as FERG, and also the Source Attribution Task Force under FERG. And existing estimates are already there. Another expert judgment study was conducted in 2015, and I mentioned here the paper by Tine Hald and all that appeared in 2016. And the advice that was then done almost 10 years later was to update these estimates. Okay, what was the idea to apply it and to have an expert judgment study, for which we had the expert judgment team that I coordinated. So we had Tine Hald from Technical University of Denmark, Roger Cook, retired from Resources for the Future, and also TU Delft, and Willie Aspinall from Aspinall and Associates. And in the team, a lot of the work has been done by research assistants from TU Delft, and I listed here their names. Their contribution was all very important in carrying out the whole expert elicitation study. What about the roles? Because, okay, there was a big task to be done, and a lot of parties being involved. That was made quite clear from the beginning, and we needed support from each other. And I want to acknowledge, first of all, the roles of WHO and great contribution of Yuki Minato and Charlie Law, who were doing such a great tasks to identify and make sure that the process of identification, not only for the experts, but also for elicitors, were made in time and smooth. And we could have access to experts, a lot of experts, very, very quickly when needed. How did the expert elicitation happen? It was an open call for experts. I'll say that later on, but just to mention that, one of the first ideas was, okay, let us reach out broadly via WHO channels so that at the sub-regional level, we make sure that we reach out to experts across all the regions. Another contributing party was FERG that I mentioned before in the task force, and also great help from Sarah Pires, and their contribution was at the, let's say, concrete design level, providing the hazard list and also the pathway transmission that I just showed. Preparing a very, very large background document focusing on, well, all this regional information on the food supply, but also information about prior studies regarding source attribution, other information very relevant for the source attribution. And of course, coordinating the whole process and providing a lot of feedback also when, just initially results were in. So these were very important from their side. From our perspective, from our team's perspective, we were supposed to build up training materials. That was agreed that we will have training materials prepared for the experts that they would access before the elicitations. Then we designed also and selected the calibration questions that we used, and I'll say something about it in a minute. Then it was decided, being such a global and big study involving so many experts, that the best approach is to have an elicitation instrument which would be online, and this was done through Qualtrics environment. And building up, testing, everything was part of our role. And of course, conducting the elicitations in the sense that we overview it. And I'll say a few words also about the elicitors and overviewing this process as well. The elicitation were done one-to-one online interviews. So that was the idea, to have only one-to-one meetings with the experts. And of course, once the data was in, to process and to analyze and provide the estimates that we needed to have for the source attribution. Okay, I mentioned already the calibration questions, but just to give a very brief overview of the method that we use. So we use the classical model for structured expert judgment. This has been also used in the previous study to obtain source attribution estimates. And just as a building block, we are focusing on target questions or questions of interest. These attribution estimates were of interest, and specifically to the 40 hazards. We have here 24 enterics, 10 parasites, and 6 chemicals, and 6 transmission pathways and 14 food categories. So as you see, yes, the dimensions were quite high. What we also were looking into is different regions of the world, and 17 clusters of countries or sub-regions have been considered for the study, and I'll show you a bit what those are later. Then the approach is, okay, we need multiple experts' input that we are going to aggregate using a mathematical model. And the input of experts is an uncertainty, our uncertainty assessment, so uncertainty quantification regarding quantities of interest were required. And I already mentioned, but the trademark of the classical model are those calibration questions that are field related and relevant for the expert judgment study, that are helping us to calibrate the mathematical model that is going to be used to aggregate experts' assessments. What was a particular feature of this study was that we had tailored 4 hazards in a broad sense, not at the 40 hazards level, but in a broad sense, and also at the broad regional level expertise. And I'll say a bit more of how those were selected and how experts also received the calibration questions. Now, how does the model work? Based on the calibration questions, weights are formed for each expert assessments, which are used then to aggregate expert assessments on the target questions. And I don't want to give a lot of details. I have actually links to YouTube videos with the training materials where you can find out how the weights are computed. But let me just point out that the weights is being obtained from 2 scores. One is being statistical accuracy, and the other one information score. that is calculated for each expert assessment, and then using the weighting scheme. And okay, there are a number of properties and how also the formulas to be derived, but let me point out that, well, ideally we would like experts assessments that are as statistically accurate as possible and as informative as possible. Okay, now why did we use this model? Well, the most important consideration it was that it has been applied or used also in the previous expert judgment study. But the fact that, the classical model considers expert data as scientific data, so enabling this empirical control is also paramount importance. This validation, it's also a very desirable feature to calibrate the mathematical model that is being used to provide source attribution estimates, but also being a transparent, reproducible, and defensible method. And I have here a bit of the broad steps that we can think about it in terms of calibrating a model, validating, and then, ending up with verifying. There were also practical considerations. The fact that discussions or even gathering experts was not possible. Sometimes, it was even geographically not very close to each other, but also sometimes the language barrier was also present. And also we had multidisciplinary panels, and sometimes because of this language barriers that I mentioned, interviews were actually conducted in different languages. Okay, I mentioned the 40 hazards. Here is a list. Yes, I'm not going to read all those. I became quite knowledgeable throughout the study for many of these, but still it's impossible to pronounce them. So yes, we have 40 hazards, and I already mentioned the sub-regions. I have here a map showing at the broad regional level, for example, Americas, that is further split according to World Bank economical information. So we have, for example, America A, B, and C, differentiating the countries with respect to economical, let's say, values or norms. The same happens with Europe. The same happens with Africa. We have East Mediterranean region here, and Southeast Asia and West Pacific. And again, within each broad region, we have this further classification with respect to economical considerations. Okay, this was at the geographical level, and I mentioned more information about the calibration questions. We had them specific for the 3 broad classes of hazards: enterics, parasites, and chemicals. And for example, they had what we had in mind to have broad categories of calibration questions. A very important aspect in source attribution is food supply. So therefore, the food supply was a cluster of questions that we considered. I have here an example actually from the previous study from 2015. Those that we used are not public yet, but they will be public when, the results will be published. So, for example, about food supply, calibration question was among all subregions in 2010 what was the proportion of regional vegetable supply in tons that was imported rather than produced domestically in the subregion with the highest such percentage. And okay, this was a cluster of questions. Then other questions concerned health and diarrheal diseases, improved water sanitation, and outbreak and disease surveillance. I have here another question related to an EFSA annual report from 2012. And as I mentioned, we are asking experts to quantify uncertainty, and the way to do that is to ask for experts 3 percentiles. We have the best estimate, or the 50th percentile, representing the center of the experts distribution. And then on the left and the right, having a representation of a lower and upper uncertain bound, meaning the 5th and the 95th percentile. And this setup was done not only for all the calibration questions, but also for the questions of interest. So yes, the 3 estimates for each question were required from each expert. Now, I mentioned that this tailoring happened. So how did it work in practice? We developed 77 calibration questions. And I have here a table for enterics only. And yeah, with these broad clusters of calibration questions, we have those 4 here. And you can see that in each of these 17 subregions, how the questions were done. And in particular, we have here food supply. Here it mentions that question 1.1 is used, but actually the research assistants have prepared the data accordingly at the regional level. So in Africa, I think there was a question regarding the consumption of poultry. So that was at the regional level asked. And then for experts who are assessing estimates in Europe, then they will receive a similar question for Europe and so on. So all this we have been tailored at the regional level. Then we have the health and diarrheal disease, outbreak, and so on. And you see the differences. And here were the studies that we have been using to ask questions on outbreaks and disease surveillance. And the WASH actually have been used for all the regions. There were quite generic questions on water sanitation. Okay, what about the process? So as I mentioned, WHO had an open call inviting experts across the globe to participate in this expert judgment study. Which was fine, and I'll share that it was quite a lot of experts being involved, but throughout the months and later on when we investigated for all the hazards and subregions, we identified gaps. And then networking, so either via a FERG or snowball effect came in because we really needed expertise, so to cover expertise for all the 40 hazards and 17 subregions. So the open call was complemented by networking to be able to find the experts. Then once the expert selection, was taking place or already started, we were very busy developing the tools. So we had multiple Qualtrics surveys where experts were asking for several information across the study. So we started first by having information from their side at the hazard and regional level. Because in the open call, the information was still quite generic. It was not tailored to all the 40 hazards. And later on, we asked them. So it was based on self-report about the expertise about the hazards and regions that we considered. And this information we obtained from the experts. Then we had a training module, again in Qualtrics, that we prepared that went through several steps and information about the study itself, the method, and so on. I'll say some details later, but it also included a consent form for the study. And as I mentioned, the interviews, the one-to-one interviews were conducted, so then this followed in the process. And the aim of the interviews were to first cover the calibration questions. This was mandatory for each interview. And to go through one hazard so that the experts see how the questions are being posed, the online setup and so on. And they could later on continue. And of course, that needed to happen because many experts had multiple hazards and also across multiple regions. So there were quite a lot of questions to be answered from their side. Hopefully that happened within 2 weeks when we received complete assessments of all hazards and regions. In practice, that didn't happen so often, so a gentle reminder and sometimes chasing of the expert assessments was needed. Yes, in the end, some managed to provide the assessment, some not. And well, it is what it is, but okay, we were needed to move on to the analysis. And afterwards, a small, short feedback survey was provided to the experts so that they can provide some feedback over the overall process. And I have just one quote to show you a bit on the feedback. Okay, this was the process at the step level, just to give you an indication of the size of it and how many experts were considered. In the open call, which was open from July 2023 to May 2024, around 850 applications were registered, and from those, 290 were identified as eligible to be considered for the expert judgment study. And additionally, because as I mentioned, the gaps were still for specific hazards region combination, we reached out to 152 experts via the network. Then, as I mentioned here, experts were providing specific hazard/regional information about their expertise. And 400 of those experts provided this kind of information. And in the training module, I just looked yesterday, the 476 accessed the training module, and I could see that some of them were accessing multiple times before the elicitation. But in any case, quite an accessed survey, yes. Okay, from those experts, 392 were invited to the interviews, but actually only 233 had the elicitations. And that means that we have calibration assessments from 233 experts. Unfortunately, not all continue to provide any assessments for the questions of interest. And we only ended up, well, only still a very big number, but when we look down from the numbers from above, yes, 175 provided assessments, either complete or partial assessments for the target values. Okay, now to put things graphically in perspective, because I already mentioned a number of key things, but that this is a bit of a roadmap that we had developing the protocol with expert and elicitor selection, which I didn't cover. I'll say something about the elicitor. Yeah, very practical things of sub-region panels, languages, training materials, then developing the tool itself, providing support for the elicitors who were conducting the elicitations, and then the elicitations themselves, and moving towards the analysis. So this was a bit on, let's say, process-wise, the main steps, and of course with the documentation throughout the way. And to put a perspective in the timeline, we started with the preparation of all this early 2023. By October, we were well along the way to construct the elicitation tool, which was done in December. So then we started actually with the elicitations in December 2023. And a year later, we were providing our first results for the source attribution. So yeah, it took an entire year to have the whole process and be able to have estimates for all the hazards at the hazard sub-regional level. Where we are now, there was exhaustive feedback from the task forces regarding the preliminary results, and there were also feedback required from the experts. There was quite an intense process in, let's say, finalizing the estimates, where I think we are now. And country consultation has already taken place, and yes, estimates are, I think, into near final stage now. We are not by far done with any, let's say, writing and reporting the results. This needs to still be happened, but okay, we're approaching quite quickly the end of the project. Okay, I want to say a few words, and I see a bit late, but okay, I'll take a bit more time on the expert identification and selection, because I mentioned WHO was in charge of it, but actually that was done by the Collaborative Center, looking at this expert CVs and thinking that, okay, at the larger area expertise, meaning that either pathogens, parasites, or chemicals was enough. But later on, self-reported by experts, expertise for specific hazard sub-region was needed as further information. So this was done as the screening, and the networking of 152 experts were also needed. And as I mentioned, with the Qualtrics survey, we were looking at specific hazard regional expertise. So, and also asking experts to rank their expertise. So here is a screenshot of the Qualtrics, meaning that for all these hazards and for specific region, experts would need to provide their expertise with a scale from 1 to 5, where 1 denotes a very low, meaning no direct experience with a specific hazards. 1 means some direct experience, but wide reading, and high meaning 5, high meaning primary focus on my professional work. And based on this self-reporting, actually the experts were being selected, and later on we saw that they also selected this in the elicitation as the hazards to be assessed by them. Okay, I didn't mention a lot with the elicitor, but yes, elicitors were an important part of the study because they were the ones who were conducting the interviews. And of course, their identification and selection was also important. WHO helped us a lot in identifying elicitors. So 65 eligible elicitors were identified in 2 batches. Because the first one, yes, we well, basically ended doing the elicitation, and we needed to carry on others, and therefore we needed a second batch. We were asking elicitors information about their degree and field in which the degree was granted, and also whether experience with communication in a professional environment took place, and also access to stable internet connection and experience with online environments. That was also important. As a bonus that we actually ended up using was being able to conduct the interviews in another language than English, and French, Spanish, Arabic, Mandarin, Portuguese, or Russian was considered. And we ended up using Spanish and French and Mandarin. I think that those Portuguese, yes, they were used as a language of elicitations. And of course, we needed to have time zone coverage, making sure that we pair elicitors with experts in relatively close time zones. That was quite important. Okay, 65 elicitors were identified. They also had to follow a training module, and there were also 2 onboarding sessions online available for them to introduce them to the expert judgment study and give them information about, well, the process and what they need to how they need to carry out the expert elicitation. We also provided them with a full interview script that was meant for them to have a good idea what needs to be covered during the elicitation. And the steps, of course, they could actually alter it a bit or start just as they wished, and that turned out to be the case. But for those doing it for the first time, we had a lot of feedback that it was quite important to have the script that gave them confidence to go through the interview. Okay, we started with 65, but we ended up with less, and we had 27 active elicitors in the end that were paired with experts by the study team, and they scheduled a meeting and conducted the elicitations. They were also provided support either via Teams or WhatsApp if they had any questions, or the experts had questions and that they needed support in answering them. And we also got quite some feedback from the elicitors. There was a survey prepared, and many of the elicitors filled in the survey, but also notes that they made, or through the emails we got that. After the interview, the elicitors didn't need to pursue and make sure that the expert assessments were coming in, because we did that. So we monitored and follow up with the experts. So that means that after the interview, the elicitors were done with their role. I want to acknowledge the active ones who conducted at least one elicitation, and their great support, and also some of them reacting after so many elicitations saying, okay, it's fine, I know it needs to be done in Spanish. Edward was great on doing a lot of work, and being available with the Spanish, let's say, the elicitations that needed to be to take place. Okay, now the training materials, how we envisioned it to happen, we thought, okay, it's important that we communicate information about the method, but also about the expert judgment studying itself through video. So we have here the ones introducing the method and the study. We also emphasize the need of uncertainty quantification and how this is done within the classical model. And we've had an interactive video where experts would need, participants, viewers needed to fill in or to provide answers to a question so that they could actually progress and see the rest of the video. And just as well, fun initially, but very useful, I have here a quote saying that video with a Q&A, so the typical question of experts thinking, I don't know, or yeah, am I really an expert, and so on. So if you want to see Roger and me doing a bit of this Q&A session, yeah, feel free to watch it on YouTube. We got a lot of feedback, positive feedback from the experts during the elicitation, but also I wanted to have it from the survey that this role play video was very helpful, that it gave voice to doubts and procedure of the elicitation. So it was very much appreciated. Okay, we not only prepare videos, but we had 6 training questions. We wanted experts to be familiar with the setup and the format of the questions. Those were also tailored to broad expertise, meaning either enterics and parasites or chemicals. And to which a lot of experts, they provided this assessment. So for us, it's quite important to see assessments on these questions and correlate them with the calibration questions. We also added 5 quick questions about the method, very easy things about whether it's possible to have to provide equal percentiles, or whether the 5th and the 95th percentiles need to be symmetric with respect to the median. So yeah, very basic things, but also turned out quite useful for the experts so that they knew exactly, okay, oh, so this kind of assessments are also possible. And yeah, I just looked at it yesterday and mentioned it already. The training module was actually accessed quite a lot, and a lot of experts found it very, very useful. They watched it many times even before the elicitation. Good. A few words on the elicitation tool. Yes, it was developed in Qualtrics also because we thought having a GDPR compliant tool was very important. But an online tool where things were collected automatically was very, let's say, convenient and very appealing for the team from the beginning. It was also very nice that experts, so based on their selection of hazards and regions, then the whole survey was completely tailored. That was very, very nice. We initially thought we could do it in one big survey, but because then all the questions, the calibration questions, and all the possible questions for the training, for the target questions were more than 9,500 questions. Yes, it was really huge. We saw that actually it was not possible to save all these assessments. So in the sometimes early 2024, we needed to separate the survey so that we have first a calibration and then generate surveys based on the selection there, but separate surveys for the target questions. But okay, all is good, and we could have then a smooth, let's say, process of getting expert data in through Qualtrics. And just as you, some information about how the interviews look like, or sorry, what kind of information the experts needed to provide. Yes, it started also with the selection of the hazards. So again, experts needed to provide this information because it tailored also the calibration questions. And by therefore selecting, for example, all 3 American regions and knowledge about Europe A, or here about also America A, and so on. Based on this, the surveys were generated where immediately the information regarding to that specific hazard was appearing, and then they needed to provide the 3 quantiles regarding the 6 pathways here. The interviews were scheduled for 1 hour and a half, and I would say most of them were fine, even some quicker than 1 hour, especially with the training module and so on. We also had outliers. I remember I had an elicitation, it was about 3.5 hours or 4, but okay, I said it's great. The expert wants to take the time to really think about the calibration question. So yeah, I think it was worth the time. I want to end up with some remarks that, okay, from the beginning, the challenges were known about source attribution for foodborne disease and to quantifying this even in high-income countries. And We acknowledge this with previous structured expert judgment studies for CDC or RIVM. So yes, structured expert judgment provides a transparent way of obtaining attribution estimates where yes, appropriate and relevant data is lacking or even other methods are not available. And this update was necessary, and we wanted to have that from 2015. And these estimates are, of course, important in their own. Source attribution is a very important topic for policy making, but it's also helping in getting and having estimates for the global burden of disease. So that's a step further that is also being implemented as we speak. So source attribution is the first step, and then yes, the burden of disease is computed next. And of course, gaps and uncertainties exist, but yeah, we believe that such estimates are the best current source of guidance to support decision makers when allocating resources for control and intervention and for future research initiatives. With this talk, I wanted to give an overview of the process and the steps and the design that we took, and also preparatory and all the training material. I envision that two other talks will follow, one focusing on the training and the insights through the training materials that we got. And of course, with a very important question for the expert judgment community, whether training helped. And I want to acknowledge here very important work of Emrecan Özeler, who for his master project, he looked into the training data and had a very good and nice analysis with very interesting insights that he will present the next expert judgment WHO structured expert judgment talk. And of course, the third talk that it's of course should be in the pipeline is that, okay, we have basically 680 studies that have been conducted at once. And for that, we have the typical analysis at the calibration questions that we compared individual performance with decision makers and various decision makers that have been involved and so on. So we started a bit looking, and yeah, we already have preliminary results, but it would be very nice to share those insights as well. Good. As a final thing, I want to mention the MOOC, Massive Online and Open course. If you're interested in getting information about the classical model for structured expert judgment, feel free to check this. It's open most of the time, and it's self-paced and gets you the basic knowledge to understand the method and to apply it. That was it. Thank you. I'll stop sharing and